Many of us have spent our entire lives hearing about the benefits of vitamins, especially vitamin E. We've been told it's good for our skin, our hearts, even our immune systems. And while there's some truth to those claims, there's a critical piece of information that often goes overlooked, especially for those of us past 70. If you've ever strolled through the supplement aisle and noticed the high-dose vitamin E bottles with their shiny labels promising stronger health and sharper vitality, you're not alone. They look appealing, as though a single pill could turn back the clock or protect us from every ailment. Yet here's the concern. Many pharmacists and healthcare providers are starting to caution older adults about these very products. The reason? High doses of vitamin E can thin the blood more than we realize, leading to a heightened risk of dangerous bleeding episodes that can affect everything from simple bruising to more severe conditions. Why does this matter so much right now? Because the senior years are often when we're already dealing with multiple medications, changes in our bone density, and a host of potential circulatory challenges. At 65, 70, or older, our bodies respond differently to nutrients and chemicals than they did in our 30s or 40s. We may also be taking blood pressure medications or blood thinners, or dealing with conditions like diabetes, heart disease, or arthritis. That fragile balance can be disrupted by something as seemingly harmless as an over-the-counter supplement. If we go on believing high-dose vitamin E is the quickest path to vibrant health, we might overlook how it can tip the scales in a risky direction. Now, you might be wondering, how can something so widely recommended also be so concerning? The truth is, supplements are not tightly regulated in the same way prescription medicines are. Labels can be confusing, marketing claims can be misleading, and what's considered high dose for one person might be moderate for another. But if you're in your 70s or beyond, everything about your health picture is a bit more delicate. The good news is, by understanding these risks, you can still enjoy the benefits of proper vitamin E intake while avoiding the dangers of unnecessary high doses. Over the next few moments, we'll explore the real story behind vitamin E supplements as we age. We'll look at why the body's response changes, bust a few misconceptions that might have you reaching for the largest dose on the shelf, and consider the safest, smartest ways to approach your nutritional needs. By the end, you'll walk away with clearer guidance, practical steps, and the knowledge to protect your well-being without missing out on nutrients that genuinely support your health. After all, it's about making informed decisions that help us live better. I've spent years studying how different supplements interact with the aging body, consulting with pharmacists, nutrition experts, and real seniors who've taken these products. My aim today isn't to scare you, but to help you make sense of the conflicting advice. If at any point you have questions, jot them down and don't hesitate to discuss them with your healthcare provider. Your health is unique, and so are the decisions you make for it. Let's dive deeper into why this caution matters so much. One of the biggest challenges many older adults face is juggling various pills and vitamins, not realizing how each one can affect the other. So as we go along, try to reflect on what you're taking now. Does your current supplement routine truly match what your body needs? Or have you fallen into the trap of taking more because you believe more is always better? My hope is that once you understand these points, you'll feel more confident in discussing your supplement choices with a professional who knows your health situation. In doing so, you'll protect yourself from hidden risks and set yourself on a path to a safer, healthier routine in your golden years. Let's start by challenging one of the most common assumptions about vitamin E, that you can't possibly get too much of a good thing. It turns out you can. And for older adults, it might be easier to cross that line than you'd think. First, there's a widespread belief that vitamin E is entirely harmless, no matter the dose. So many of us see these eye-catching labels on supplement bottles, some offering 400 IU, 800 IU, or even 1,000 IU of vitamin E, and assume that if it's sold over the counter, it must be safe for everyone. There's also the idea that the higher the dose, the better the protection against illness. Let's look at a real example. Consider Alan, who's 73. He's relatively active, loves gardening, and has been told a few times by his doctor that his cholesterol is borderline. Alan heard from a friend that high-dose vitamin E could help lower his risk of heart disease. So he went to the pharmacy and picked up the biggest dose he could find, figuring it would offer the most benefit. Alan didn't realize that his daily aspirin regimen, taken on his doctor's advice to reduce heart attack risk, combined with a high-dose vitamin E supplement, could substantially increase his risk of unwanted bleeding. He started noticing that small cuts on his hands from his garden pruner took a long time to stop bleeding. Bruises on his forearms appeared more frequently and stayed longer. At first, he brushed it off as just another getting older quirk. But when he mentioned it during his next checkup, his physician immediately spotted the interaction. High-dose vitamin E can interfere with how blood clots, and in combination with other medications that also affect clotting, like aspirin, certain anti-inflammatory drugs, or prescription blood thinners, the effects can multiply. Now, it's not that vitamin E itself is fundamentally bad. In moderate amounts, it has antioxidant properties that help protect cells from damage. However, the key word is moderate. Excess can contribute to a situation where your blood is too thin, meaning you could experience excessive bleeding from what should be minor injuries, or even risk more serious internal bleeding. The body's natural clotting mechanisms are finely tuned, and as we age, they can already become less predictable. That's why when people ask whether they should take high doses, the first piece of advice from most pharmacists is to look carefully at your overall medication list and any known health issues. If you're wondering what practical steps you could take right now, the first is to examine the label of any vitamin E supplement you might have at home. Check the dosage. Is it significantly higher than the recommended daily intake? If you're unsure what that recommendation is, know that for most older adults, around 15 milligrams, or 22.4 international units, per day from food and a standard multivitamin is typically sufficient, though it can vary based on dietary sources and individual health conditions. There's often no need to jump to 400 IU or 800 IU unless directed by a healthcare professional. Second, consider keeping a medication list and bringing it to your next doctor's appointment or a pharmacist consult. Their expertise can help you avoid dangerous overlaps. The physical benefits of right-sizing your vitamin E dosage can be profound. Better wound healing, fewer unexplained bruises, and reduced risk of major bleeding incidents. Emotionally, it offers peace of mind. You can maintain an active lifestyle, like Alan, who loves gardening, without worrying that a minor nick or bump will turn into a significant ordeal. Take a moment to think about your own supplements. Have you checked the dosages? How many different medications do you use daily or weekly? It might be worth jotting them down now or making a note on your phone or a piece of paper so you can discuss them with your healthcare team later. Next, let's tackle another common misunderstanding. Many people believe that vitamin E alone can solve a host of senior health problems, from poor immune response to low energy and heart worries. The marketing campaigns often emphasize one or two studies suggesting some benefit for this or that condition, but overlook the bigger, more nuanced picture. This brings us to another real-life scenario. Barbara, at 77, started taking a high-dose vitamin E supplement because she was constantly feeling run down. She'd seen an advertisement saying it could boost her immune system and help her bounce back from colds faster. Since she'd been catching a lot of colds, it felt like a quick fix. What Barbara didn't realize was that the feeling of low energy had multiple other causes. She was dehydrated most days, not getting enough sleep at night, and her diet was lacking in certain key nutrients like iron and vitamin B12. By focusing on just vitamin E, she neglected a range of simpler, more essential steps that could have tackled her fatigue at the source, like improving her hydration, checking her iron levels, and making small changes to her meal planning. She also missed out on more balanced solutions, such as taking short daily walks, which can improve both energy and immune function over time. When we place too much faith in a single supplement, we can create tunnel vision that leads us away from addressing the fundamental contributors to our well-being. Nutritional science tells us that real food sources of vitamin E, such as almonds, spinach, avocados, and sunflower seeds, often come packaged with other beneficial nutrients our bodies need. The synergy of vitamins, minerals, and healthy fats in whole foods can be more protective than isolating one vitamin in high doses. That's not to say there's no place for supplementation. It's simply that we should consider them exactly that. Supplements to an otherwise balanced approach, not miracle cures. So, what's the actionable step here? If you're feeling run down or looking to support your immune system, consider taking a broader look at your health habits. Are you staying hydrated? Consuming enough protein, fiber, and a variety of fruits and vegetables? Getting good quality sleep? Even moderate physical activity, like a daily walk or gentle stretching, can significantly boost your sense of well-being. From a nutritional standpoint, explore foods naturally rich in vitamin E. A handful of almonds or sunflower seeds, spinach in your salad, or sliced avocado on your toast can do wonders. Not only will you get vitamin E, but you'll also get fiber, healthy fats, and other vital nutrients. And if you still feel that you might need a supplement, talk to a pharmacist or dietitian about low-dose options that align with your specific needs. Emotionally, shifting your mindset from a single solution approach to a more holistic one often feels empowering. You're no longer dependent on one pill that may or may not work as advertised. Instead, you're building a foundation of healthier habits. That sense of control and balance can lead to better overall resilience and energy. At this point, you might find it helpful to pause and reflect. If you've been taking a high-dose vitamin E supplement because you heard it could help in one specific area, consider whether you might be missing other, more comprehensive approaches. Sometimes the simplest questions, like "Am I getting enough rest?" can provide the biggest insights. If you need to, jot down a quick note about how you've been sleeping or the variety in your meals over the last week. Being mindful in this way can guide you toward changes that are far more beneficial in the long run. Another point worth exploring is how these supplements interact with the natural changes in our bodies as we get older. Many of us already deal with issues such as thinning skin, changes in digestion, and shifts in our metabolism. Add to that the possibility of taking multiple prescriptions, perhaps something for blood pressure, another for joint pain, maybe an occasional over-the-counter pain reliever. And it's easy to see how a single nutrient that has blood-thinning properties could amplify certain risks. Consider Marvin, who's 80. He's on a mild blood pressure medication and occasionally takes an anti-inflammatory drug for arthritis. After reading an article praising vitamin E for heart health, he decided to start on a high-dose supplement. Over a few weeks, he began noticing that his ankles and feet seemed more swollen, and when he had a routine dental procedure, he bled more than usual and took longer to clot. Alarmed, he visited his pharmacist, who explained the interplay between his medications and the supplement. Because both his anti-inflammatory drug and high-dose vitamin E can affect blood clotting, Marvin was setting himself up for complications. The swelling in his ankles was partly related to circulation changes, but the extended bleeding time pointed to the blood-thinning effect. Pharmacists often recommend that before you add any supplement, especially one that can affect how blood flows, you discuss it with your doctor or pharmacist. Why? Because they can run through your medication list and check for potential conflicts. They might say, "Given your medical history, we need to adjust your current treatment plan if you want to incorporate vitamin E," or "We can find a lower, safer dose that won't put you at high risk." That's exactly what happened in Marvin's case. He didn't have to ditch vitamin E entirely, but he did need to scale back his dosage and time its intake differently relative to his other meds. This scenario underscores the importance of managing not just individual issues, like heart health, but also the broader picture of your well-being. The human body is an interconnected system, and especially as we age, a change in one area often ripples out into another. Knowing this can help us avoid the trap of quick fixes. It also highlights why it's so important to keep open communication with professionals who understand how various medications interact. From a practical standpoint, what can you do? First, make a list of all the medications and supplements you take, including doses and how often you take them. Keep that list updated and carry it with you to doctor's appointments, or even snap a photo on your phone for easy reference. If you decide to try a new supplement, consult your pharmacist about potential interactions. They can often spot issues before they become real problems. Physically, this awareness will help you avoid painful or scary incidents, like unexplained bruises, extended bleeding, or circulatory complications. Emotionally, there's a real sense of relief in knowing you have a plan and that you're not just randomly adding substances into your daily routine. It's a proactive approach that respects the complexity of your body and the wise counsel of trained professionals. If it's been a while since you've done a thorough medication review, consider this a prompt to set one up. You might be surprised what a difference it can make when you align each supplement and prescription with a clearly defined purpose, eliminating unnecessary overlaps or risky doses. Finally, let's address a third point. The idea that simply stopping a supplement if side effects occur is enough to guarantee safety. We often assume that if something goes wrong, we can just toss the bottle in the trash and move on. But the reality is more nuanced. Sometimes damage or risks can build up gradually. If you've been taking high-dose vitamin E for months or even years, your body has been adapting to that increased anticoagulant, blood-thinning effect over time. Even if you stop tomorrow, you might still need a period of careful monitoring, especially if you've also been on other medications that affect blood clotting. Let's look at a scenario involving Fran, who is 76 and has been taking high-dose vitamin E for about a year. She started after reading that it could help with hot flashes and hormonal changes in older women. But over the last few months, she noticed she was often lightheaded, especially when getting up from a chair. She also had frequent nosebleeds, something she never dealt with in her younger years. Concerned, Fran decided to quit the supplement cold turkey. While that might reduce some of the risks, she hadn't told her doctor yet. She wasn't aware that her body was also adjusting to a new blood pressure medication that could sometimes lower blood pressure a bit too much when combined with other changes. When she finally mentioned her nosebleeds and lightheadedness, her doctor was concerned. Fran had a minor ear surgery scheduled the following month, and her medical team needed to know about any supplements that might have prolonged her bleeding time. By quitting the supplement without discussing it, Fran created a gap in her treatment record. No one could accurately predict how her blood might react during or after her ear procedure. The medical team asked her to do some blood tests and carefully monitored her for signs of continued bleeding issues. Ultimately, everything turned out okay, but it was more complicated than it had to be. What's the takeaway here? The best course of action is always open communication. If you suspect high-dose vitamin E or any supplement is causing adverse effects, don't just stop on your own. Talk to your healthcare provider. They might want to taper the dose, run a blood test, or monitor you for a period to ensure everything returns to normal. Practically speaking, this might mean planning a timeline for discontinuation or switching to a lower dose, along with periodic lab checks. It also underscores the importance of letting your entire healthcare team, primary care doctor, specialist, pharmacist, know what you're doing with your supplements. Physically, taking a measured approach to discontinuing a supplement can keep you from abrupt changes in your blood's clotting mechanism. Emotionally, it provides reassurance and helps you feel you're in safe hands. And that feeling matters a lot because stress and uncertainty can sometimes compound other health issues, affecting your sleep, mood, and overall resilience. Now, as you reflect on these stories, Alan with his gardening cuts, Barbara with her unexplained fatigue, Marvin managing blood pressure meds, and Fran facing nosebleeds, you might see a pattern. Each person believed in a common misconception about high-dose vitamin E. Whether it was that more is always better, that it could be the sole solution to a complex issue, or that quitting abruptly posed no risk. Each discovered the truth only after experiencing unpleasant or dangerous side effects. The good news is that you can learn from their journeys without having to go through those experiences yourself. By balancing your approach, focusing on real food sources of nutrients, engaging in moderate physical activity, maintaining open communication with healthcare professionals, and being willing to make small, incremental changes, you can protect yourself and still reap the benefits of appropriate supplementation. It's worth pausing to consider your own routine. Have you had any unexplained bruises, prolonged bleeding, or even subtle symptoms like frequent lightheadedness or faintness? If so, that's something to bring up sooner rather than later. On the flip side, if you feel perfectly fine but you're worried about potential long-term risks, this might be the perfect time to schedule a medication and supplement review. If you've never done one, it's a simple but powerful step toward ensuring everything you take works in harmony. Before we wrap up, let's recap a few key ideas so they're clear in your mind. Too much vitamin E can thin your blood, especially when combined with medications that also affect clotting. Relying on a single supplement for all-around health can distract you from more comprehensive and often simpler interventions. like balanced nutrition, hydration, and adequate rest. Adding any new supplement to your routine should be done under the guidance of a professional who can spot interactions with other meds. And if side effects occur or you decide to stop, communicate openly with your healthcare team so they can guide you through a smooth and safe transition. While these points might sound serious, don't let them scare you away from pursuing better health. Think of them as practical insights that let you step confidently into your wellness journey. Supplements have their place, but they should never overshadow the bigger picture: a balanced lifestyle, consistent medical care, and informed choices every step of the way. So where do you go from here? You might take a few specific actions depending on where you stand. If you've been taking a high-dose vitamin E supplement, consider talking to your pharmacist or primary care doctor about whether it's truly necessary. If you haven't, but you were considering it, research food-based ways of getting more vitamin E, or look for a lower dose, high-quality supplement. Or maybe you're exactly where you need to be. Just be sure to stay vigilant for signs that something isn't working right. Trust your instincts if you feel off. In the days ahead, imagine what it feels like to move forward without the nagging worry that you might be setting yourself up for a surprise complication. Envision confidently tending your garden, walking the dog, or even enjoying a gentle exercise class at your community center, knowing that the supplements you do take fit seamlessly into your overall plan rather than creating risks. Whether you're 70, 80, or beyond, you still have so many vibrant possibilities ahead. There's no reason to let misinformation or hasty decisions about supplements cast a shadow over your golden years. As you think about these points, I invite you to set a small, manageable goal for yourself. Maybe it's compiling that medication list or planning to chat with your pharmacist next week. Perhaps you'll start by slowly integrating more vitamin E-rich foods into your diet. Or you might simply share this information with a friend who also might benefit from it. In any case, every step you take toward a better understanding of your health is a step toward greater peace of mind and a safer, fuller life. Remember, you are in charge of your choices. This stage of life is about harnessing wisdom, ensuring your habits align with your values, and protecting your future health. You don't need to accept any one-size-fits-all solution, especially not in something as critical as managing your supplements and medications. So stay curious, ask questions, and keep exploring. When you respect both the strengths and limitations of any supplement, vitamin E included, you can achieve a balanced approach that honors your body's unique needs. Above all, stay empowered. You've gained insight, you've considered the risks, and you're equipped with the know-how to make informed decisions. Now's the time to put that wisdom to use. Whether it's a call to your doctor, a consultation with your pharmacist, or a conversation with a trusted friend, take the next small step. Your health and peace of mind are worth every bit of that effort. Thank you for spending this time learning about high-dose vitamin E supplements. By focusing on the bigger picture and prioritizing balanced, informed choices, you can avoid unnecessary complications and keep enjoying the activities and connections that bring meaning to your life. And that's truly what it's all about: staying safe, staying engaged, and living these years with the vitality and independence you deserve.